lovely to see you again. How have you been since I last saw you for your annual physical exam? Oh, well, that sounds very exciting. Oh, I'd love to know more about that. Sure, maybe if we have time at the end. So, you are obviously familiar with the procedure of the cranial nerve exam. You've had many of these in the past. So like I said, on your annual physical exam, you probably could do this to me if you so desired. I know that you could probably do it with your eyes shut too, right? I'm just joking. So, as always, let's do name, date of birth, and consent. Perfect. And cranial nerves are the nerves that supply your face and your neck, and we'll be systematically going through them all, testing to see if they're working correctly and whether or not there are areas for concern. So does that all sound good to you? Perfect. So let's start with your eyes first of all. Let me get my little flashlight. It's been playing up recently. I think it needs a bit of charge. It's a handy little USB one, so no cables to lose. Right, so just look straight at me. I'll just do pupil reaction time. Good. Perfect. Great. Good. Excellent. Right, so this bit might be a bit uncomfortable, but just look at me. I'll be coming very close to you and looking inside your eyes. Okay. Good. Okay. Any pain at the moment? Okay. Look up. Look down. And from side to side. Alright, that's great. So, just remind me, do you wear glasses at all? Sure. And when was the last visit to your opticians? You're due. Okay. Do you think anything has changed in the last 12 months with your sight? Well, it happens to us all. So I would definitely, you've booked, right? Oh, you need to make a booking, right? Well, I definitely get booked in if you're noticing changes to your vision. It's always best to get it early. So I just need to grab my Snellen chart. Yeah, we have all gone digital, I'm afraid. Although I very much miss the old paper style that you used to hang on the wall. It seems a little bit impersonal now. Everything is done digitally. I don't know how you feel about that. Alright, so can you read the top line? Great. And then just move your way down until you can't read anymore. Anything below that? You would say, okay, well that's actually pretty impressive. But if you feel like your eyesight is deteriorating, then yeah, but as far as I'm concerned, your eyesight seems to be within normal limits. Okay. So, instead of the light following, I'm going to ask you to follow my finger this time. So keep your eyes straight ahead. Just follow my finger. Good. Good. Excellent. All right. And just hold there. Great. Any pain or discomfort? All right. So now with your eyes to me, how many fingers am I holding up? And now? And now? What about now? And now? Good. Just shout them out. Perfect. Now, tell me which of my fingers is wiggling. Just point to it. Good. 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 Now tell me when my fingers go outside of your vision. Just say when. Good. 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 Well done. All right. So I'm going to put one finger here and one finger up here. Focus on this finger and now focus on this finger. Good. Focus on this finger. Now focus on this finger. Excellent. Now focus on this finger. Now focus on this finger. Focus on this finger. Focus on this finger. That is perfect. Now we're going to make it slightly challenging. I'm going to get this occluder. Let's start with your left eye. Can you tell me how many fingers I'm holding up? What about now? 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 Good. Now, can you tell me when my finger is wiggling? Just say yes. Mm-hmm. 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 Perfect. Now, let me know when it goes out of your peripheral vision. Good. 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 Excellent. Now focus on my finger here. And focus on my finger here. Focus on my finger here. Okay, that's fine. Let me move it back a bit. Any better? Alright, what about over here? Alright, perfect. Now we're going to do everything on the other side. So, first of all, how many fingers am I holding up? Just shout them out. Good. Perfect. Now just say yes when you see my finger wiggling. Okay, good. And just tell me when it moves out of your peripheral vision. Good. Good. Very good. Okay, now focus on my finger here and over here. Focus on my finger here. That's right, good. And here. Excellent. Okay, perfect. So now let's move on to the nerves of your face, specifically sensation. So I have a sharp tool and I have a soft tool. Just tell me, do you identify that as sharp? Good. And do you identify that as soft? Perfect. So now close your eyes and tell me, is that sharp or is it soft? Correct. Is there sharp or is that soft? Excellent. What about now? Sharp or soft? Good. Sharp or soft? Good. What about now? Sharp or soft? Perfect. Now keep your eyes closed. I'm going to be coming a little closer to you. Tell me where this is touching, specifically on your face. Good. 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 Excellent. And now, where is this on your face? And what about now? And now. Perfect. Okay, you can open your eyes. So now I'm going to be looking at your face here. I'm going to be asking you to do some various different movements, motor functions of your face. We'll start from the top down. Could you scrunch up your eyebrows? That's right. Good. Just keep them scrunched. Okay, good. Now if you can close your eyes and scrunch them as tight as you can. Try and resist me trying to open them. That's good. And relax. Now puff out your cheeks and try and resist me closing them, like pushing the air out, sorry. Good. Now open your mouth wide. I'm going to try and close your mouth here. Just resist. Good. And now close your mouth and try and open it, but I'm going to try and stop you. That's good. And now can you suck your cheeks in? Good. And then bare your teeth like that. Good. Stick out your tongue. Excellent. good. Now can you purse your lips as if you were to whistle? And can you roll your tongue like that? Very good, very impressive. Okay, so did you feel any pain or discomfort when I was doing that? You kind of grimaced a little bit when you sucked your cheeks in. Alright, that's absolutely fine. They can hurt really bad, can't they? I had one on my tongue once, a little ulcer. Oh, it was the most painful thing. So that's absolutely fine, as long as it wasn't any motor function related pain. So, hearing. Now, if I remember rightly, you said that you didn't have any changes to your hearing last time I saw you, but you were going to get your hearing checked regularly because of your job, right? Okay, well, in that case, we can omit the tuning fork because we did it last time and I only saw you a few weeks ago and that was perfect, so I doubt there's any changes to that. And earwax production, I remember that this was phenomenal. Your ears were so clean. So that leaves us for the whisper test. So I think we'll start further back. You can close your eyes, it probably makes it a little bit harder, but I'm going to whisper a word and a number and you just repeat those back to me, okay? So I'm going to scooch back a little bit. Okay, so here we go. Shall I repeat that? Sure, okay. Okay. And now the number. 42. And again. 42. Alright, good. Quite difficult, but you got it. Very good. Going to be coming a little bit closer to you and whispering a word and a number in this ear first. So, dandelion, good, 4, good. Now this side, alphabet, 100. Good. Alright, so that's perfect. Your hearing is really impressive and I'm glad that you are taking preventative measures to preserve it, especially with the type of work you do. So let's move on to your nose now. When I saw you for your annual physical exam, we just were a little bit concerned about allergies. Have those cleared up, or would you say that you're still suffering at the same level as you were before? Okay, so they're still present but not as bad. If we were to do the scent test, would these aggravate you in any way? Sure, well, if they do, then we will stop and we'll just maybe call you back in once the allergies have settled down, but if you feel comfortable proceeding, then we can proceed. Okay, so I have some little bottles of scent. Now, if you can occlude your left nostril and just tell me what this scent is. Perfect, correct. Lemon. Now swap over, occlude the other nostril. Can you tell me what this scent is? Good. Mint. Perfect. I'll just do this one. So swap over again. Include your left nostril. Tell me what this is. Coffee, correct. Now let's do a hard one. Just occlude the other nostril and tell me what this scent is. Can you guess it? Correct. It was tea tree. Very good. Perfect. And that didn't irritate your nose at all? Okay. Well, that's very good. So now let's just check the mobility of your shoulders. Do you have any pain in your shoulders or your neck before we begin? Alright, that's good. So I'm just going to put my hands on your shoulders. I'm going to push down and you just resist me. Good. Now shrug your shoulders up, but I'm going to keep trying to resist. Okay, that's good. Now I'm just going to hold your head. I'm going to try and move it to this side, but can you just resist me? Good. And the other side. Good. Now I'm going to put my hand on top of your head and just try and resist me pushing your head down. Good. And lifting your head up. Good. Any pain or discomfort? Okay. Well, I think we did that in record time, don't you think? Great. Well, I know you're very, very busy, so I'll let you go. But from what I can see, all your cranial nerves are functioning perfectly. I'm really, really happy. So I think, yes, correct, you can book in now for your annual physical exam for next year, and I believe your cranial nerve exam too. I mean, that would make perfect sense to come and have them done on the same day, yes. I also like to do that, schedule my appointments back to back, and then I don't have to have another day out of work. No, that's absolutely fine. Well, as always, it has been a pleasure to see you, and well, I'll see you next year. Take care.